Imagine working so hard to save lives that your job is the reason you lose yours. Crazy, right? But that's the reality of a lot of doctors, especially in Nigeria. Now, just recently, a doctor lost his life, Dr. Ogenetega. Lost his life because he was denied sick leave from job to go take care of his health. And it's crazy to even think about. Now, you know the funny thing, yeah? Is that this happened at a military hospital. Now, I'm not trying to stigmatize or anything, but in fact, share this video as much as you possibly can. If you're here to subscribe, do well to subscribe and share this video to anyone looking to do their house job, to anyone looking to even do their NYSC placements and all of that, please. You have to actually look into where you're going to before you even get to that place. And if you want to do your housemanship and you feel like, oh, I can be able to survive working in a military hospital, I can be able to survive working in some kind of teaching hospitals, fine, that's good. You want to take up the challenge, feel free. But please and please, it is not worth it for you to lose your life because of your job. Like, it doesn't even make sense. Honestly, avoid these hospitals as much as you possibly can. The funny thing is that there are informations out there. I'm not trying to say this is his fault or whatnot. Sometimes you don't have control over where you're being posted to, and I quite understand it. But as much as it depends on you, as much as you have the power to, do not take yourself to these hospitals because you might not even live to tell the tale at the end of the day. I know we all want to be sacrificial doctors, doctors that go way and beyond for our patients. I feel like we so much put so much pride and value on doctors that overwork themselves. It feels like we glorify suffering at this point, and it is crazy to even think about. Like, what are you even trying to prove to someone else? What are you even trying to prove to your fellow doctor, like that you can be able to weather the storm and work 72 hours non-stop? Who are you trying to freaking impress? Mind you, it is your life you're talking about, honestly. And no matter how you want to see it, yeah, it takes a toll. This job takes a toll on you in the long run. And I want to plead, like, I really honestly just want to plead with you, you that is looking to do your house job, you young doctor that is looking to even do your NYSC, I want to plead, take your health seriously. Take your freaking health seriously. Sometimes during the course of my job, sometimes, most times, in fact, the course of my job requires that I work 24 hours shift in the emergency. And it sometimes is very crazy. You just keep getting patients back to back to back. And I'm not saying this for you to be disrespectful or for you to try to, put it in the face of the authorities and all of that. But yeah, sometimes you need to take a break. I know that the Nigerian system sometimes, not sometimes, in a lot of places, don't make provision for break time for doctors. Don't make provision for, okay, this is when you're going to be on a break. It is left for you to make those rules. It is left for you to now put those rules in place. If I'm working 24-hour shifts, I know that at least within the first 12 hours, I should have taken a break to go and sip something, to go and take food and all of that. Not neglecting your patients, quite all right. In fact, you have to do this with wisdom. Come on. Come on. Do you get what I'm saying? If you're working 48-hour shift, you have to take a break. And sometimes it is still not enough, in all honesty. You're taking 10 minutes break and for you to come back and work yourself out. In fact, that's by the way. Now, this doctor has lost his life here, and he has been added so casually to the whole statistics of doctors that have lost their life working in Nigeria. And it is crazy to even think about. And the worst part is that when you break down in that same hospital you find yourself, you still have to foot your bill. It was crazy to even experience back then in house job. There was a doctor that fainted. I don't know why fainted there during the course of his job because of the whole stress of it and everything. And he still had to foot his bill. He still had to pay his bill. He still, like, every freaking thing he needed to be given at that point in time, he had to cover for it. And you're working in a freaking hospital. Well, that's by the way. So this doctor has casually, so casually, been added to the whole statistics of doctors that that have lost their life. May his soul rest in peace. But this goes out to you young doctors. Now, I've made a lot of videos over the past couple of months about how we can be able to rectify this, what is the next step, try to enlighten people as much as I possibly can about the ways to, cut the whole stress thing short and how to manage your time, blah, blah, blah. But now we are coming from a very different angle. Yeah. It's your life is your responsibility, no one else. Honestly, no one else. If someone else had the opportunity to work you out, like to get the best out of you without even paying you, honestly, a lot of people would jump at the idea. So your life is your responsibility. There's someone that in the comment section of one post in particular that said that he doesn't bloody care, that whenever he is sick and he feels like he needs to go home and take care of himself, he jumps at the idea, and whenever he comes back, he faces the punishment and all whatnot that will be dealt him. But that's a different way of looking at it. But whatever floats your boat, no problem. But honestly, your life is your priority. Your life is your responsibility. No one is going to come and tell you, oh, it's time to take a break. Like, no freaking person. Your employer would not do that. He needs his job to be on track. He needs his job to, I, there are some people that would do that, but then it's not their responsibility to. Your life is your freaking responsibility. Whether you're a doctor, whether you're or whatnot, it is your responsibility. And I need you to guard it because you're precious to someone else. You're somebody's daughter, you're somebody's son, you're somebody's child, you're somebody's mother, in fact. And it is crazy to think that you lose your life in the course of saving other people's lives. It is honestly crazy. Let me not. It is honestly crazy. Now, Nigeria has about one doctor to about 10,000 patients. And you know what the WHO recommendation is? It is one doctor to 600 patients. WHO recommendation. And I'm sure in a lot of other places, they have it a lot less, like the equation and all of that is a lot less than WHO recommendation. And honestly, what? 1 to 10,000 patients? And you know, the funny thing is that, yeah, doctors keep leaving. Now doctors keep let me just paint this narrative. Doctors keep leaving the country now. Yeah, why are they leaving? They are leaving because they don't have very good working condition. Majority of them, they are not being paid enough for the workload, shitload of work they do in this country. Honestly, yeah, they are not being treated right. Exactly, yeah, they are being maltreated, most of them kidnapped and all whatnot in the course of their jobs. Yes, they keep leaving the country to find better working conditions, to get better payment for the work they do. For the work they have spent most of their lives training for and all whatnot. Yeah, and they keep leaving the country, and we keep facing a shortage of doctors in Nigeria. Like, the remaining doctors are now being overworked. The remaining doctors are still left to face or to take care of the same number of patients that excuse me, that the other doctors left behind. Yeah, so we have double work for the fewer doctors that are around. Yeah, now, in order for the policies, yeah, that are affecting doctors to be changed a little bit, let's say, okay, let's try to keep these doctors back. Let's try to keep all these professors and good people that are leaving, not good people, you know what I mean, but like efficient people that are leaving this country in drones to stay back in this country. In order for us to make the working conditions a little bit more favorable, let's try to, pay them a little bit better. Let's see if maybe they are going to get back and stay in the country and all of that. We don't do that. Yeah, we don't do that. Instead, we put checks and everything to prevent them from leaving. We even, put some laws in place to prevent them from leaving. And what is the result? They leave further. They don't bloody care about your checks and restore and rules and all whatnot, because their lives are literally at stake. And I feel like we don't realize this as much as we can. People are leaving, specialists are leaving, even people that have attained the heights of professorship are leaving the country. But by the way, that's another talk for another day, because a lot of people are mocking them and all of, like, why should you mock somebody for choosing to start afresh in a in an environment that gives him better working rights, better working conditions, that pays him even times 10 of what he's earning here in this country. Like, why shouldn't he leave? And you're mocking him for leaving. Well, that's talk for another day. But instead of you to do all of that, you don't. You just, in fact, you turn a blind eye to their cry. You turn a blind eye to whatever it is they're saying. And then when NYSC comes, when housemanship comes, you see a lot of doctors, they are clamoring, or they are trying to go to places that, they are not going to be overworked. They're trying to look for places that, they are not going to be paid chicken change. Because another point of view to look at it is that now the doctors that are left, you've not increased their pay. Yeah, you're not giving them better working condition, you're not increasing their pay to what they are supposed to earn, for somebody that took all of these years out to become this thing, and it's now giving back to society and all of that. You're not going to increase their pay to what it should be. Yeah, you're still giving them peanuts for what they have. So they try to work multiple jobs, they try to take on other jobs. You see a doctor working in like three different hospitals. In fact, I got a call recently from somebody that works in one laboratory outside of this facility, outside of my hospital. I was like, doctor, I know you're working in two or three other places. Send patients to come and do, because in a facility where I work, we don't have some kind of, endoscopy and MRI and the rest of them. So we tend to send these patients out. And then, yeah, she was like, I know you work in other places. Send these people to come to our facility and do the. And I'm like, who gave you the impression that I will have another job? Do you get? And this is they know, people know this. People know that these doctors are taking multiple jobs in order to earn something that would be enough to make them live a at least comfortable life in this country. Still, you do nothing. Still, you do freaking like, sometimes when I'm making these videos and I tell myself this is going to be the last time I tend to talk about this is going to be the last time I tend to talk about this, but things keep happening. Like, a doctor loses his life in the place where I went to do housemanship just recently. Yeah, a doctor also lost his life. Yeah, that was before we started doing our house job, and God rest his soul. And I heard about this news, and so coming in, I told myself a couple things. I know I want to be the most dedicated, most hardworking doctor. I'm going to give my patients my 100 of over 100, but I have to draw the line. Like, these are the things that clicked in my mind, and I told myself, guy, you have to draw the line somewhere, because if you don't take time, yeah, you're going to see yourself overworking yourself. You're going to be overworking yourself. You're going to try to want to get more money than, you're going to try to want to make a lot more than you're being paid in a one particular place. And it doesn't make sense that we have to take on two jobs in order just to live comfortably. It's not supposed to be normal, especially for doctors, because guy, you're going to overwork yourself. You're going to come to one of those jobs really drained, really strained. It shouldn't be our normal. It shouldn't be our. These things are abnormal. These things are so abnormal, and we have to tell ourselves this, because it feels like we're now become desensitized to these things happening. Something happened, we move on. Nothing is done about it. The doctor has lost his life. God. And it's sad to say, honestly, but this job is not what your life. You didn't want to be a medical doctor in order to lose your life while being a medical doctor. I don't think there's anybody that had that in their rule book, or had that in their plans or anything. You didn't become a doctor to lose your life. It shouldn't be what your life. In all honesty, I know that you're passionate about this job. It is a job, by the way, if you're still thinking in the light of, I'm doing this for passion. It is a freaking job. Yeah, you earn a source of living out of it. If not, why are you moving to another country in order to be paid better? Please don't annoy me. But you get what I mean, yeah? It is not what your life. And the system is killing doctors. It's literally killing. It's been designed in such a way that you can't even have a breathing space. Do you get? Sometimes I take some time out to go for lunch, yeah. In the course of my 24 hours, say I take 10 minutes in the middle of the day just to go get food and watch the nurses call you up to 10 times. Watch the nurses call you multiple times just for that breathing space you took. And if you're not careful, you start having guilty conscience. Ah, why am I even leaving work? It's just 24 hours. It's just, you start telling yourself it's just, and then when you break down the cost of the job, you can't even be guaranteed adequate resuscitation. You're not guaranteed proper. That's by the way, it is not worth your life. And I'm tired of coming over here and talking about these things and trying to enlighten young doctors as much as possible. Please, young doctors. I know that we are already trying to, make different way for ourselves, trying to do things better. No, we shouldn't be like our seniors. We shouldn't be like our forefathers. I know that medicine is difficult and everything, but it shouldn't get to the point where we have to lose our life for this. Now, if you are sick, if you are genuinely, now I know that in the course of, in every mass whatever, in everything that blows up as big as this, a lot of people want to try to hide under the umbrella of, I'm sick, I'm this, blah blah blah. But if you are sick, yeah, and you see that a leave is not being granted you, if you are ill, if you there's something about your health you need to take care of, drop a letter of notice and move. Honestly, move. Oh my god. Move, and don't take your health so lightly. So many times, all over the news, all over the social media, you see doctors trying to give free tips for the public, free tips for patients. Don't do this, how to take care of your health, how to do this, how to do this. But they are no advocates for doctors. They are advocates, honestly, but then nobody comes out to say, doctor, drink this. Doctor, I think I need to be that. Maybe I should be that. But there's nobody to come and want, doctor, you, I know you're working. Take water right now. Do you get? People are all for patients and all of that. They should be doctors' advocates. I think a lot of people should. In fact, that should be a new content idea for you. Come out and talk about doctors. Go and take water right now. Go and eat food. You've worked 12-hour shift. Go do this. Do you get? I don't know, honestly. I honestly don't know. Which is why I ask a lot of questions. I ask how females in medical school and even doctors, how they are able to cope and achieve so much for themselves, and they are still alive and they are still healthy and they still have very good loving families. Like, how are you able to do all of this? Now I'm digressing, but you get the point. No job should be worth your life. The essence of you working is so that you can be able to earn a livelihood to take care of yourself and your families and your loved ones here, and to live a comfortable life, not to go into the job and lose your life. I think there should be balance. There should be balance. And if you're taking up 3, 4 jobs in order to make ends meet and all of that, I know that things are terribly hard. If that's the way you can be able to cope, fine. But sometimes take a pause. A month, 2 months, just go. Do a full block count. Do one of these tests. Try to take a time to rest. Honestly, it is necessary. It is very necessary. And if you want to live very long, healthy lives, yeah, if you want to live very long, healthy lives as doctors, we need to take our health seriously. There is no right person in their right frame of mind that will tell you to prioritize your job over your life. Like, there's nobody. If that person is saying that, just look the other way, go the opposite direction. So no, being a doctor should not cost you your life. Yeah, doctors should not prioritize their jobs over their lives. If anything, they should prioritize being alive long enough to be able to do their job well, because a dead doctor cannot save lives. Yeah, I think this is where we'll end it for today. Honest, I literally just got back from work and I need to rest. Yes, I need to rest. Let me go and rest. Yeah. So stay safe out there. If you get to subscribe to this channel, do well to subscribe now. Yeah. Please do well to subscribe. And I love you guys. I'll catch you guys in the next one.